company arrange lorry, I first to here come reading. That's why easy.
30-year-old construction worker Sajat has just finished seeing a doctor at this medical center in 63 Loyang Way. Soon, the primary health needs of migrant workers like Sajat in Singapore will be taken care of in medical centers like these across the island under a new system. The Ministry of Manpower had put out a tender on Monday, June 28th, seeking proposals from healthcare providers to run 6 regional medical centers and 3 on-site medical centers in large dormitories. Slated to launch as early as November 2021, the new structure is meant to provide cheap, good, and accessible care for both acute illnesses like sore throats, as well as chronic conditions like diabetes for the migrant worker population in Singapore.
In the longer term, for the medical centers, the migrant workers can look forward to where they want to seek medical care. At least they know the existence of the medical center. They know that when they are sick or unwell, they will come forward straight to the medical center, rather than allow the employers to decide where they see the doctors. Also, from the employer part, they are becoming more aware that there's the existence of the regional medical center.
Under this new structure, the island will be split into 6 geographical sectors, each serving at least 40,000 migrant workers, both living in and out of dormitories. Each sector will be anchored by a regional center and complemented by the on-site centers. There will also be at least 2 mobile clinical teams, round-the-clock telemedicine consultations, ambulance, and special transport services. Each of the 6 medical centers will be the first-line outpatient facility for migrant workers. These new medical centers will succeed the 13 existing ones that have been operating since August 2020. Currently, this on-site medical center at PPT Lodge 1B serves more than 15,000 residents in the dormitory. This includes workers next door at PPT Lodge 1A. It sees around 50 to 80 people on an average day.
It's fairly similar to those that we see outside in the community. The usual, as in nowadays, the focus on the ARI, acute respiratory symptoms, your usual diarrhea, vomiting, tummy pain, urine symptoms, and so on and so forth. Of course, we also see those what are called chronic conditions like hypertension, hyperlipidemia, diabetes, and asthma, so forth. Here-wise, in this dormitory setting, migrant worker setting-wise, there's a bit more where we see of those more work-related ones, such as we see things like rashes, dermatitis, and we see occasionally foreign body goes into the eye, that sort of things.
According to Dr. Ho, having a clinic on site lets workers have access to early care for ailments.
For foreign workers, very often when they come and see doctors, they kind of come a bit late. For example, certain conditions like abscess, so infections-wise, we do notice that they tend to they wait that extra 3 days, that 1 week, and then the infection gets bigger-wise, and then so it takes longer to heal. That here-wise, fortunately-wise, because being on site, I think it actually kind of breached this, this barrier-wise, so they seem to be a bit more willing to come in to see us.
Last time, if I sick, then I have to take a MC paper, medical paper. Then I have to go medical by taxi or MRT or whatever transit I have to follow. Then I have follow long queue. Then it's also wasting my time. If I injury, then I have to waiting long time. And if I can coming here like this medical center, so I think I have get by short time the treatment.
Another requirement set by MOM was that medical care should also be provided in a way that minimizes any cultural and language barriers. This is to encourage the workers to not delay if they need medical help.
Doctor also very good talking, no angry. That's why I go 2-3 time again speak this one angry but here 2-3 time also again this one no understand my talking again talking but no angry.
Another advantage of the new system is that it will also serve to detect and curb future disease outbreaks through active health surveillance.
Okay, so before the setting up of the medical centers, migrant workers usually either self-medicate or they see their company doctors. With the setup of the medical centers, we also provide valuable surveillance data for MOM. This includes the type of illnesses that we see on a daily basis. With this data, MOM can have a better sense of any outbreaks and to manage these outbreaks in a better way.
If every dormitory have like this medical center, so they no need to go the company, and they can save the wasting time.